Lawmakers in Albany are being asked to add more safeguards to a prescription drug practice known as step therapy, or fail first. It's when insurance companies require patients to first use a medication other than what a provider initially prescribed. It may be a generic drug that's cheaper than the preferred medication. If the alternative drug fails, then the insurer will typically pay for the original prescription ordered by the doctor. Reforms to the practice initially passed in 2016, but advocates say they still must jump through too many hoops to ensure patients get the best treatment. In some cases, they say trying a different medication first may have grave consequences.
Is very concerning because of the patients that we treat, specifically patients with hemophilia, have a very rare bleeding disorder. The fail first for our patients means they would have to have a bleed, and that might be a bleed internally in a joint, into a muscle, and there's no like safe or good bleed. They're all very bad.
Jessica Wolf is the CEO of Western New York Blood Care. She says their team has been able to successfully convince insurers to cover or pay for the preferred treatment option first, but it requires a lot of back and forth with insurers. The New York Health Plan Association opposes the proposal. NYHPA represents 26 managed care health plans across the state. Among other things, they say the measure will lead to higher prescription drug prices. In a statement they write, restricting step therapy would mean increased costs for consumers and employers, both in higher premiums to account for overall increases in drug costs and higher co-payments and out-of-pocket costs for more expensive drugs. The Senate has already passed the measure. It is now awaiting a hearing before the Ways and Means Committee in the New York Assembly.